Pharmacy tech appealed to me a lot because it plays to your technical skills, your knowledge about medicine. On the retail side of things, you have a lot of people skills and interacting with insurance companies. On the hospital side of things, you get a lot of kind of bench scientist, compounding, chemotherapy drugs, and it's also a stepping stone to perhaps pharmacy school. There's the Texas Tech School here in town, so that's always a great kind of end game for this. So the Pharmacy Tech program gets you your Level 2 certificate with your IV certification. That qualifies you to work retail, to work in a hospital environment. IV certified technicians are in high demand, and it also gives you opportunities to move forward into specializations like chemotherapy or even pharmacy school. The working conditions can vary pretty greatly depending on where you are. At retail, you typically interact a lot with customers face-to-face, and there's a lot of go-betweens between different doctors and insurance companies and pharmacists, getting people prescription medications. In a hospital setting, there's a lot more technical work to be done. It's typically more of a closed system where the orders are filtered down and you just need to worry about the drugs. You almost never have to deal with insurance, and you're more doing sterile compounding and bench work like that. So the program is a kind of a hybrid of online courses and in-person courses. A lot of the online courses are set up in such a way, kind of like a flipped classroom, where there's a lot of information you need to get through and a lot of drug names, a lot of drug classes and types, things that you can do at your own pace on your own. Things that reading and studying are the main things that will lead you to learning that information, while there's more in-person work with labs where we learn the actual techniques, get really great hands-on experience. And then of course there's our clinicals, where we actually go to a retail pharmacy and go to a hospital pharmacy and get incredibly valuable hands-on experience there. I probably have learned the most from the actual clinicals, because you get to see the day-to-day, what it's really like, not just what it's supposed to be like in the classroom. This semester especially, we've done a lot of labs. Some of them are pretty simple, straightforward, like learning how to count pills and set up a basic prescription file. Some of the labs are a little more complicated, like unit dosing with a gigantic machine heating up and printing labels, and that's more of a hospital setting. Some of them are the most advanced, where you have to gown up and wash up, get ready for a sterile environment, and then go work in that sterile environment to create IV drugs, especially chemotherapy drugs. Are some of the most difficult and require the greatest care to do properly. So another lab that we do is counting each individual pill for blister packing. That's often useful for nursing homes, for patients who are on a long-term prescription and might forget day to day whether or not they've taken their pills. So that really helps patient compliance with those prescriptions. We learn how to do IVs, everything from proper cleaning up technique, garbing technique, aseptic basics, to injections, manipulating the syringe, to loading the bags with drugs, double checking them for particulates, having everything in the correct place and order, even cleaning up the vent hood. That's an important part of it. Yeah, some of the equipment we use day to day is really basic, just a plastic pill tray, some plastic sample vials, some sugar pills. They're not real drugs, but they look like the real drugs that you use. Some of it's more sophisticated, the unit dose machine back here, which you'd use in a hospital setting, and the IV vent hoods create a sterile environment for making IVs and chemotherapy drugs. Personally, I plan to try to work in a hospital setting. I think the technical nature of that work is something I'm very interested in. I'm really enjoying my clinicals in the hospital, and we'll have to see about pharmacy school, but here's hoping.